Have you ever been talking to someone one moment and the next moment they can't finish a sentence? Or maybe you've heard someone say, they seemed perfectly fine yesterday. A stroke has a frightening way of appearing suddenly. But here's what many people don't realize. Most strokes don't actually come out of nowhere. Your body often gives warning signs. Your blood vessels slowly change over months or even years. Your brain quietly becomes more vulnerable. And if you understand what's happening before a stroke occurs, you may have a much better chance of preventing one or getting life-saving treatment in time. Today, I'm going to explain stroke in the simplest way possible. You'll learn what a stroke really is, why it happens, the early warning signs that should never be ignored, who's at greatest risk, what happens inside your brain during a stroke, and most importantly, what you can do every day to lower your risk. Because when it comes to stroke, knowledge truly can save a life. Let's begin. Think of your brain as the control center for your entire body. It controls your movement, your speech, your memory, your vision, your emotions. Even your heartbeat and breathing depend on it. Although your brain only weighs about 3 pounds, it uses nearly 20% of the oxygen your body takes in. That's an enormous amount, and unlike other organs, your brain cannot store oxygen. It needs a constant, uninterrupted blood supply every second of every day. Blood carries oxygen and nutrients through a network of arteries that feed every part of the brain. Now, imagine someone suddenly pinching a garden hose. Water immediately slows down or stops flowing. Everything beyond that pinch begins to dry out. That's essentially what happens during a stroke. The blood supply to part of the brain is interrupted. Without oxygen, brain cells begin to die. And here's the frightening part. Brain cells start dying within minutes. Doctors often say, time is brain. Because every minute treatment is delayed, millions of brain cells are lost. That's why recognizing symptoms quickly is so important. There are actually 3 main types of stroke. The first, and by far the most common, is called an ischemic stroke. About 85% of all strokes fall into this category. This happens when a blood clot blocks an artery supplying the brain. Think of it like a clogged pipe. Blood simply can't get through. These clots can form inside the arteries themselves because of cholesterol buildup. Or they may travel from another part of the body, often the heart, and become stuck inside a narrow brain artery. The second type is called a hemorrhagic stroke. Instead of a blockage, a blood vessel actually bursts. Blood leaks into or around the brain. This bleeding places pressure on brain tissue while also reducing blood flow. High blood pressure is one of the leading causes of hemorrhagic stroke. The third condition is called a transient ischemic attack, or TIA. Many people call it a mini stroke. But don't let the word mini fool you. A TIA is a medical emergency. The blockage is temporary, so symptoms usually disappear within minutes or hours. However, a TIA is often your body's final warning before a major stroke. Many people who experience a full stroke had a TIA days or weeks earlier. Ignoring it could be one of the biggest mistakes someone makes. So what exactly causes these strokes? One of the biggest culprits is high blood pressure. Imagine constantly turning up the water pressure inside old plumbing. Eventually, those pipes weaken. The same thing happens to your arteries. Over time, high blood pressure damages their delicate inner lining. That damage makes cholesterol more likely to stick. It also makes blood vessels weaker and more likely to rupture. Another major cause is cholesterol buildup. You've probably heard the term plaque. Plaque is a mixture of cholesterol, fat, calcium, and inflammatory cells that slowly accumulates inside arteries. Year after year, the passageway becomes narrower. Eventually, blood flow slows. Or a piece of plaque suddenly breaks open. Your body reacts by forming a blood clot. That clot may completely block blood flow to the brain. Atrial fibrillation is another common cause, especially in older adults. This is an irregular heartbeat. Instead of pumping blood smoothly, the heart quivers. Blood can pool inside the heart, forming clots. If one of those clots travels to the brain, it can cause a stroke within seconds. Diabetes also plays a major role. High blood sugar damages blood vessels throughout the body. It also accelerates plaque formation. Smoking damages artery walls. it thickens the blood, raises blood pressure, reduces oxygen, and greatly increases stroke risk. Obesity, lack of exercise, heavy alcohol use, poor sleep, chronic stress, these all contribute as well. One question I hear frequently is, "Doctor, how would I know if someone is having a stroke?" Fortunately, there's an easy way to remember. It's called FAST. The letter F stands for face. Ask the person to smile. Does one side of the face droop? Is the smile uneven? A stands for arms. Ask them to raise both arms. Does one arm drift downward? Can they lift both equally? S stands for speech. Ask them to repeat a simple sentence. Do the words sound slurred? Are they confused? Can they find the right words? Finally, T stands for time. If any of these signs appear, call emergency services immediately. Do not wait. Do not drive yourself if possible. Do not hope it goes away. Every minute matters. But strokes don't always look exactly the same. Some people suddenly lose vision in one eye. Others develop double vision. Some become extremely dizzy. Others lose coordination. Some experience sudden numbness on one side of the body. Others develop a severe headache unlike anything they've ever felt before. One patient once described it as, "It felt like someone flipped a light switch inside my head." Another said, "I knew what I wanted to say, but the words wouldn't come out." Every stroke can look different depending on which part of the brain loses blood flow. That's why any sudden neurological change deserves immediate attention. Many people assume stroke only affects the very elderly. That's not true. While risk certainly increases with age, strokes can happen in people in their 40s, their 30s, and sometimes even younger. However, after age 55, the risk rises dramatically. Men generally experience strokes slightly more often. Women also face significant risk, especially after menopause. Family history matters too. If close relatives have experienced stroke, heart disease, or vascular disease, your own risk may be higher. The good news? Many risk factors are actually under your control. Let's talk about prevention. The number one priority is controlling blood pressure. If there's one number every adult should know, it's their blood pressure. High blood pressure usually causes no symptoms. That's why it's called the silent killer. You can feel perfectly healthy while damage quietly occurs. Checking your blood pressure regularly is one of the simplest ways to protect yourself. If your doctor prescribes medication, take it consistently. Don't stop just because you feel fine. Next comes nutrition. Your arteries appreciate real food. Vegetables, fruits, beans, whole grains, nuts. Healthy fats like olive oil. Fish rich in omega-3 fats. These foods help reduce inflammation, improve cholesterol, support healthy blood vessels. On the other hand, highly processed foods often contain large amounts of sodium, unhealthy fats, and added sugars. Too much sodium raises blood pressure. Excess sugar contributes to diabetes and weight gain. Neither is good for your brain. Small daily choices eventually become major health outcomes. Physical activity is another powerful medicine. You don't have to run marathons. Even brisk walking for 30 minutes most days makes a tremendous difference. Exercise improves circulation, lowers blood pressure, helps control weight, improves blood sugar, strengthens the heart, and even supports memory. The best exercise is the one you'll actually continue doing. Walking with a friend, swimming, gardening, dancing, chair exercises. Movement is medicine. Sleep deserves more attention than it usually gets. Poor sleep increases inflammation, raises blood pressure, disrupts hormones. If you snore loudly, wake up gasping, or feel exhausted every morning, talk with your healthcare provider. Sleep apnea significantly increases stroke risk, but is very treatable. Managing diabetes is equally important. Keeping blood sugar within your target range protects blood vessels throughout the body. Regular eye exams, foot care, healthy eating, physical activity, medication when prescribed. These all work together. If you smoke, quitting is one of the greatest gifts you can give your brain. Within months, your circulation begins improving. Over time, stroke risk gradually declines. It's never too late to quit. Even people who smoked for decades can benefit. Let's clear up a few common myths. Myth number 1. If symptoms disappear, everything is fine. False. Temporary symptoms may actually indicate a TIA. You still need emergency evaluation. Myth number 2. Only people with high cholesterol get strokes. Also false. People with normal cholesterol can still experience stroke if other risk factors exist. Myth number 3. I'm too healthy. Unfortunately, stroke doesn't always discriminate. Fitness lowers risk but doesn't eliminate it. Always respect warning signs. Many stroke survivors recover remarkably well. The brain has an amazing ability called neuroplasticity. Healthy parts of the brain can sometimes learn new ways to perform lost functions. Recovery often includes physical therapy, occupational therapy, speech therapy, and lots of patience. Some improvements continue for months or even years. Early treatment and rehabilitation make a tremendous difference. That's another reason why getting to the hospital quickly matters so much. I also want to mention something that families often overlook. Stroke doesn't just affect the patient, it affects spouses, children, friends, caregivers. Simple daily tasks may suddenly require assistance. Recovery becomes a team effort, support, encouragement, and patience become incredibly valuable. No one should face recovery alone. Here's something I'd like every viewer to do after watching this video. Learn the fast signs. Write them down. Teach your spouse. Teach your children. Teach your grandchildren. You may never need that knowledge, but if you do, it could literally save someone's brain or their life. The biggest message I hope you take away today is this: stroke is serious, but it is not completely unpredictable. Your body often gives clues. Your lifestyle matters. Your blood pressure matters. Your cholesterol matters. Your blood sugar matters. The choices you make today help determine the health of your brain tomorrow. You don't need perfection, you simply need consistency. One healthy meal, one walk, one blood pressure check, one doctor's appointment. Those small actions add up over time. Your brain works tirelessly for you every single day. Taking care of it is one of the best investments you'll ever make. Thank you so much for spending these few minutes with me today. If you found this explanation helpful, please give this video a thumbs up. It helps more people discover information that could genuinely save lives. And if you're new to the channel, be sure to subscribe and turn on notifications. Every week, we share simple, science-based health advice designed especially for adults over 50, helping you stay stronger, healthier, and more independent for years to come. Until next time, take good care of yourself, and remember, your health is your greatest investment.